right. Good morning or good afternoon, depending on where you are. I'm Angie Grover, co-founder and COO of Metopio, and we're going to get started in just a few minutes. And while we let everyone log on to the webinar, I'm going to launch a poll that you should see on your screen. We'd love to do this to understand what you're most interested in hearing about today, so we can be sure to tailor our remarks to meet your needs. So if you can, while we let everybody log on, go ahead and take that poll. I'll repeat this one more time as people join us and we get ready for kickoff. I usually start at 2 minutes after, so we got about another minute for folks to join us. But we're so thankful that you're here today. So go ahead and take that poll for us and we'll get started in just a moment. All right. Good morning or good afternoon, depending on where you are. Again, I'm Angie Grover, co-founder and COO of Metopio. We have a poll up. If you're just joining us, go ahead and let us know what your chip challenges are. We are excited to have you all join us today. A bit of housekeeping. For today's webinar, we'll have the chat turned on. And we'll be managing it. So if you have questions or comments during the presentation, we'll do our best to get to them. Half an hour goes really, really quick. If we don't get to your question, we will follow up with you directly. Both the slides and the recording will be distributed after today's call. So go ahead and take that poll. I'm going to get my screen ready to share here. All right, let's close that poll and get started. So it looks like folks today are really focused on measuring that collective impact, creating reports, and finding programs. If you have others you want to share with us, go ahead and enter those in the chat. We're going to get started today, and I am thrilled to be able to do some introductions. We're going to talk about some of these chip challenges, talk about some of the deciding factors about how you do decide what you're going to do, and offer some innovative solutions. So I am so pleased to be able to introduce our guests. Rebecca Mixon is the Manager of Community Impact for the Baton Rouge, Louisiana-based Franciscan Missionaries of Our Lady Health System. Now, in talking with her, she said she would never consider herself an expert in implementation planning, even though she's been working in this field for a good bit of time at this point. And I think she does have a lot to offer. As a data geek, the CHNA and CHIP process are right up her alley, and she works with her teams to try to inspire the same enthusiasm for the work she feels privileged to do on behalf of all the people they serve. Also with us today is my colleague and Metopio's Community Health Director, Sarah Vanausdall. She leads our community health portfolio, partnering with public health departments and health systems across the country to use data to understand the community, complete assessments, conduct primary research, and develop implementation plans. Sarah was a Metopio super user before joining our team and has been critical in informing how we continue to develop our platform to make it easier to do these assessments and improvement plans. So thank you both for joining us today. And I wanted to get started by talking about, as we move from our community health assessments into the improvement planning process. Rebecca, do you want to just, I know you're in the thick of it right now, do you want to reflect on what that shift looks like and some of the challenges that you face when you start getting into the improvement planning process?
Yeah, absolutely. So one of our biggest challenges, and I think it's reflected in the poll that we just did, is that we just sort of had this blank slate. we have the CHNA and it has great data, and we've talked to our community partners and the people that we serve, and we feel like we've presented this great document, but now we have to translate that into our chip. And it has to become actionable strategies. And we want that document that then turn around and inform our strategic plan as an organization. And so there's all this pressure to come up with this really dynamic, wonderful document, but where do we start? We've got to have ideas, and we know some things that we want to do. We have some ideas, but you just want it to be right. You know what I'm saying? You want it to be all those really good ideas, and they have to be fleshed out. They have to have all of these inputs and activities and outcomes and outputs and just all of these things. And it's just this blank slate of where do we start? And then you have to have that measurable impact. And that is not always the easiest thing to wrap your mind around. And so there are just so many challenges tied into the chip that once you get past CHNA and you've got that CHNA fatigue, that as you roll into chip, it's a lot sometimes.
Yeah. And Sarah, I know you've been working across the country with different folks on moving from assessment to chip. What are some of the things that you're hearing from public health departments and others as they get started on their chip?
Yeah, I mean, definitely consistent with what Rebecca shared, just to echo that. Definitely, challenges with how much time, the community health assessment, data collection and prioritization can take, you know, not using Metopio, it can be 12 to 18 months for data collection, prioritization, and report writing. So at that time, a lot of, resources are depleted, people can kind of have that fatigue that Rebecca had mentioned. So I think that's definitely a challenge. And when you get to the chip, having that continued collaboration with partners as well as collective shared goals and activities is really where you get the most impact. So if those collaboratives kind of separate and do their own chips or implementation strategies, you can lose a lot of that potential impact. And of course, similar to what Rebecca said, it can be hard to find programs that are usable for your specific organization. There are a lot of research studies or program descriptions available of what's worked for other people, but they might not be in a usable format that you can easily present to leadership or community partners in a way that quickly says, this is what we'll be doing, this is what we need, and this is the outcome.
Yeah, I think that is something we hear often. And I'm curious from everybody who's on the call, we're gonna launch a poll because, one of the things that we are trying to do at Metopia is pull together all those programs and take a look at them and give you a sense of what's out there. And we're curious, like, what do you and your team need to know as you go about your program selection? We've got kind of an open-ended in there. Do you need to know, how many hours did it take or what the budget was? Or we've got a lot of programs and we can tell you they're evidence-based, but it's really what other variables would you want to know about in order to consider whether or not a program is right for some of your priorities? So we're going to leave that poll up for a while so you can think about that and add some comments. But you both of you alluded to that impact measurement. And Rebecca, I know that you are working across multiple facilities. Do you want to talk a little bit about some of your challenges around impact and how you're thinking about that?
Yeah, so it's interesting that you say, what do you need to know about these projects? I guess the answer is yes. I need to know it. I need to know it all. The more data, the more answers that are already built into the system, the easier it is. And I find that the library in Metopio is already very helpful. But you guys are constantly updating it, and that is also very helpful. And the AI feature as well. But when you get to looking at programs and knowing that impact is the hardest part for me. I'm just going to be very honest because I'm not a population health expert. I'm not. And so when somebody says, oh, well, I want this program to improve patients' quality of life. Well, obviously, that's something that we all want to do. But how do I measure that? How can I truly know that somebody's quality of life has been improved? I can measure number of patient visits. I can measure, how many people were seen in the ER. I can know that we reduced readmissions. I can measure those types of things, but how do I honestly know that quality of life was improved? It's things like that that I find myself constantly trying to learn about and seek information about. Um, and that is difficult. That is something that we find across the board, no matter what program we're trying to implement, that really measuring that collective impact is something that we struggle with. We find ourselves sort of, I don't want to use the word dumbing it down, but making it as simple as possible for ourselves to measure things when we know what we really should do is maybe reach that stretch goal, maybe take it to that next level where we should be maybe measuring things that we aren't measuring. And that's a next season of growth for us that I would like to see us achieve.
Yeah, and Sarah, I mean, I know as we talk to folks, some of the specific things that our partners have offered up is, does the program work better in a rural or urban setting? Like, do we have to have a full-time FTE? Is there a budget, or who is the right partner? And I know that some of those things are things that you've come across, and also just looking at reporting needs. Do you want to touch on that briefly before we close that poll?
Sure. The only thing I would add, definitely agree with what Rebecca shared and what you shared, Angie. But yeah, I mean, it's definitely, the one of the questions that I get asked the most from clients is, well, what are other people doing? So there's a huge value in just seeing what programs work, what kind of successes other people have had, in order to kind of get that, buy-in from, leadership to get resources to implement those programs. And then of course, tie back into whether the actual, health outcomes that this program is going to improve. So I think there's value in kind of having everything in the same place.
Yeah, and we're going to talk a little bit about how we've moved some of these challenges into technology. As I neglected to add at the top of the webinar, this is the third in our series. So we had started out talking about that community assessment process. And as Sarah said, what Metopio has tried to do is shorten it so that we can put some of that time and energy into the community health improvement process. And the second in the series was really about rethinking those surveys that you do and how to get that hyper local data to fill any gaps that you have and be really effective. So, this webinar is kind of bringing it full circle. So now that we've done that assessment, we've collected our data and listened to our community, how do we move it into the actual improvement planning process? And so I'm going to take just a moment to show you what that looks like in software. So first of all, Rebecca talked a little bit about the evidence-based library of programs. And so what we've done is we've curated about 400 different evidence-based programs into a logic model and here we're looking at a county who's got a couple health priorities, and they're going in and looking at what programs are offered. And as you'll see, not all those facets, there's not budget facets, there's not some of those other things we would really like to collect, but we do give you all the elements of a logic model so that you can input it easily. And as Rebecca said, you can take a program you've been using for years and enter it into the logic model manually, or you can browse our library, or ask it some questions to give you some direction. So that's how we've really tried to bring your assessment into the next phase of the community health improvement process. And then the second part of that is that really hard part, that metrics part. So how do we take a look at this? And I think one of the feedback we've been getting that has been really helpful is just, what is the measurement? And how are we looking at collective measurements? So, in this example with naloxone, for example, maybe your partner is the police department, and you really want to show how can we bring this together and measure our progress. Let me make sure this is running. There we go. it could be just, a lot of these we're trying to get to that root cause. So we know this is an issue, but we need to partner with someone. And so that increased overdose response really is because the police department is our closest partner. And they've shared with us that they responded to our overall goal of reaching 100 individuals, another 15. And so we can measure that over time. And we can look at it from our perspective. You have the choice. Is it from your perspective only and what you want to report up on your activities? Or is that more collective impact? And we make it really easy to see that in a dashboard and enter it over time. As you know, on the health system side, it's a 3-year cycle. On the health department side, it's a 5-year cycle. That's a long time that you have to have an impact, and you want to see that you're making progress, or maybe flag things that need a little bit more attention. And so the way that we do that is really to produce dashboards that are dynamic and that you can select how you want to look at them. So if you want to look at one by just your theme, by putting everything into the software, you have all of your documentation. You have the program that you've developed. You've had time to create that logic model, so you know that you have all the elements that you need in putting that in. And then you can measure over time, what is our impact in mental health, in housing, in obesity, if those are your priorities. And we make it really easy to share. So this actually exports into a chip document that you can submit. You can print that dashboard if you need to share it with your leadership and they're still using PowerPoint, or you can create a link and share it with your partners. And I think that is super impactful, as it's a long time that you really need to work on these programs, and you want to adapt given the impacts and outcomes you're seeing over time. And so I just wanted to show how that was evolving and coming into the software. And so if you're doing your assessment, no matter where you are in your process, we want to be able to plug in and help support the important work that you're doing in the community. And Rebecca, I'm going to put you on the spot because I know you're in the thick of this. So, you've just started using Metopio, and I'm just wondering, showing some of these ways that we've moved your and our collective subject matter expertise into the platform. What kind of takeaways do you have in the early stages of your community health improvement planning process?
I mean, right off the bat, it has saved us so much time in our process because we're not out there just trying to reinvent the wheel. We're not out there looking for ideas. We've been able to pull from that library. We've been able to use that wonderful AI feature. And really, for me personally, I find myself leading the charge in this process for our entire health system. Whereas now I've trained users at each facility to use this software, and they have embraced it fully. I am sensing this level of excitement among them that I have never felt, which usually when we enter into chip season, it's like I'm having to drag feral children through mud into the house, and it's like, come on, everybody, let's go. Come on, we got to do this. But they are just right on the ball with this whole thing. Absolutely. Like, hey, my chip is done. I'm ready to go to my external stakeholders, and I'm ready to go to my board. There is this sense of ownership that I have never seen in the chip process just since introducing Metopio. And I feel like I'm doing an advertisement, but I'm not actually trying to do that. But just that simplicity of having something at your fingertips has helped so much. It has streamlined our effort and the time, but the idea generation, I think, has helped them. It has sparked that creativity in them again, not starting, like I was saying earlier, from that sort of that blank slate of staring at the screen. You're looking into something that's there to support you.
And I think you touched on something really important, which is these are collaborative efforts, right? This is either you in a hospital system working with people in facilities, or you in a public health department having to coordinate with CBOs or external partners. Like the whole thing about doing an assessment is bringing everyone together to move them forward. And you might have touched on this, but I think you said something about, having all this at your fingertips has really engaged people and driven them to not dread doing this, but maybe get engaged in a more meaningful way. So there's a question so the question that somebody shared was, do you drop in existing programs to the chip or just pull from the library? So do you want to talk about maybe how do you know how many programs off the top of your head that you guys just wanted to continue, and then how many you selected from the library generally?
You know what? It has varied by organization. Like I've just finished up with our facility in Jackson, and theirs were almost completely manually entered. They only had one that they pulled from the library. Just because they knew themselves, they knew their initiatives very well. They had already done so much planning with their partners that they were just very, very ready. But even not pulling from the library, it was such an easier system because that logic model is just set up so easily where you enter your activities here, your inputs, your activities, your outputs, you add your outcomes. It was just such an easy process, and then you just export it straight into your chip. It was just such an easier process than trying to do it the way we've done it before. So even that group who really was just entering it all manually there was this sense of enthusiasm, and you can enter who your partners are, and it all just spits out into this format that is just, I don't know a better word than it's just this love. It's lovely. It
Well,
is.
thank you.
It does my geek heart good to see it the way it looks because it's just very understandable. It's very navigatable. And but then, for example, at my home base, which is in Monroe, Louisiana, I would say ours was probably 50-50, whether we pulled from the library or came up with our own existing programs. So it really varies by organization.
Yeah. Well, and that's a good way to kind of, if you have other questions, go ahead and put them in the chat or in the Q&A. But I did want to just touch on some of the feedback we got from folks who are, telling us that they really wanted to know, who were the partners for some of these projects, or what was the budget and staff requirements. Are there sociogeographics that need to be taken in consideration, like where the program will be run and what startup costs are? So I think a lot of folks are struggling with the same things in terms of building that really robust, as we've talked about at the beginning. If you spend a lot of your time and energy curating that data and doing the assessment, how much energy do you have to carry it forward? And it sounds like if you can also add some of these elements to your decision-making process, then you can be more effective in that community health improvement. Let's see, there's a question that came in that says, did you use Metopio from the report process all the way through to the CHIP tool? I think you all joined us for the CHIP and you had completed your
Right.
community health assessment, right?
Yeah. Unfortunately, we did not have access to Metopio in our CHNA process. However, we are very much looking forward to having it throughout our next season.
Yeah, and that's one of the other things too, as wherever you are in your cycle, if you join us, part of your next CHNA will be, what did you do in your last CHIP? And it'll all be here
Right.
and able to
Right.
export right into that next report. I'm going to check the questions one more time. Are there financial components, just as you mentioned? Does it provide estimates of the organizational costs of development of a CHIP and implementation and subsequent evaluation? So the logic model, this from Beatrice, the logic model does allow you to put those metrics in there so that you can measure it over time. But right now, we've done a lot of research and been evaluating CHIPs from across the country, just like we did CHNAs. We looked at like 30,000 CHAs and CHNAs to get this data. And so we're trying to understand, can we incorporate some of those financial or staff requirements or sociogeographic variables that you want to evaluate as you're selecting your programs? Because we think that's super important. It's really hard to collect. A lot of the evidence-based programs, as Sarah mentioned earlier, comes from like research or other things. And so it's hard to pull all into one place. So that's something we're thinking about adding through our own data team research, and also just from our users in terms of best practices. All right, well, we're coming up quickly on the half an hour. Sarah, as you reflect on the CHIP process and you look forward, do you have anything you want to touch on in terms of the reports that people are pulling out of this, or the transition from that CHNA to the CHIP?
Yeah, I think just to kind of echo what's what's been said, to the component of, how you select programs that are connected to community needs. One thing that I don't know that we've touched on that I'm really excited about is just the ability to have all of these different programs at your fingertips in a way that's easy to share. I know a lot of times community health leaders get asked, by leadership or partners, like, can you do something about food security? And it's just kind of as broad as that. So to be able to specifically go, okay, it was a, community health need was identified. Here are all the options. To the earlier question, we might not have an exact dollar amount, but even having a good sense of, FTEs and other, inputs that are required is a lot more than a lot of people have previously had available. So I think those kind of components of just being able to present a lot of different options and drop them into your CHIP report is what's really exciting to me.
And we're so thankful to have you on the team and helping us move this forward so that it gets better and better over time. I do want to launch one more poll for everyone. We do these learning webinars, whether it's on processes or subject matters. We've talked about senior issues. We've done maternal health assessments with the data and tools that Metopio have. If we continue to do these series, if you want to sign up for the next one, let us know. I want to, if there are any last questions, but I also just want to thank both Sarah and Rebecca for sharing their expertise and lending their insights. This is a process that is a difficult one and super important, especially given our moment in time. And I really wanted to thank everyone who joined us today. We so appreciate all the work that you do every day to improve the health in the communities that you serve. Looks like there might be one more question. I'll just check in on this. Can we say the way this looks when exported? Yes, it was an anonymous attendee, but we will definitely in our follow-up look for the follow-up with the slides, etc., and we'll share that with you all in the follow-up. And with that, I'd just like to thank everyone for your time today and all of your questions and discussions. We will follow up with a recording and the slides and hope to see you out in the community doing good work to improve public health. Thanks so much, everyone. Have a great day.